Hi, everyone, and welcome to our Health Talk. My name is Alina, and my pronouns are she and her. On behalf of the Patient Education and Engagement Program here at the University Health Network, thank you for watching this session on support for Indigenous patients and families in healthcare. At UHN, we strive to provide safe and inclusive care, and that begins by honoring Indigenous peoples. Indigenous peoples are the original inhabitants of this land and for thousands of years have cared for this land. Although we are presenting this health talk in the digital world today, we want to acknowledge, remind ourselves, and encourage you to do the same too, wherever you are currently located, that we are still on the traditional territory of many nations, including the Huron-Wendat, the Haudenosaunee, and the Mississaugas of the Credit River. This territory is governed by the Dish with One Spoon Wampum Belt Treaty, an agreement to share, care for, and protect the resources around the Great Lakes in peace and respect. Today, this territory is still the home to many Indigenous peoples from across Turtle Island. We are grateful to have the opportunity to work, learn, and play on this territory. And as the speakers of this session speak about the supports that is available for patients who are Indigenous here at UHN, I'm reminded of the importance to continue to learn and find ways to advocate to ensure Indigenous patients and families have access to these services across the healthcare system. This session is especially important as Western healthcare is known to exclude Indigenous forms of care. Working with Indigenous communities will be important to understand how traditional forms of healthcare can include Indigenous care for emotional, mental, physical, and spiritual care, which can provide a safe space and place for Indigenous patients to receive care in the hospital. And thank you to those who have submitted questions. The speakers will go through some frequently asked questions that will be spoken about throughout the presentation. And now I'd like to hand it over to our speakers for today, Ashley and Victoria, to introduce themselves and to start us off with the presentation. So over to you, Ashley.
Ani, Ashley Migons Dishnakas, Chiging Donjaba, Nishnabek Endau. So my name is Ashley Migons. I am from Chiging First Nation and I am Anishinaabe. I'm a Ojibwe. I was born and raised on Manitoulin Island and I grew up on my home reserve of Chiging. And I went away to school for a short time, returned to Chiging, and I had worked there for a number of years in the healthcare field before moving to Toronto. So I've now been living in Toronto for the past 9 years, and I'm the operations and program manager with the Indigenous Health Program at UHN.
Miigwech Ashley, Ani Bojo, Nabawek Genyuzek Shikwakwe, Dishnakas, Makwadodem, Wokumakon Dojaba, Nishnabekwe, Endau. Hi everyone, my name is Victoria Mantwabi. I'm in Nishnabekwe from Wokumakon unceded territory. I was born and raised here in Toronto, and my pronouns are she and her. I am the Indigenous Patient Navigator in the Emergency Department at Toronto General and Toronto Western. And I've been working in the Indigenous community for over 15 years now. So miigwech. So today we're going to be discussing a little bit about understanding who the Indigenous Health Program is and what we do, learning a little bit about the Indigenous Patient Navigators inpatient and in the emergency department role and how to refer to our program, finding out how Indigenous approaches to health and wellness can be incorporated into your healthcare journey while in the hospital, and recognizing the importance of having a dedicated Indigenous health teams and programming embedded within the healthcare organization.
Thanks, Victoria. So to get started, just wanting to share a little bit more about the Indigenous Health Program at UHN. So we were officially established in the fall of 2020. We are currently a small team of 5 people, but we are actively recruiting. We are an Indigenous staffed program that provides support across the entire organization of UHN. So our team currently comprises of a strategic lead, a manager. We've got 2 Indigenous patient navigators and are recruiting for one more. We've got a program evaluator and we've got a couple of positions couple more positions that we are recruiting for within the program. So overall, the Indigenous Health Program, we're really just working to improve access to high quality, effective healthcare for Indigenous people. So really thinking about bringing forward Indigenous knowledges, values, and voices, and making sure that they're present and respected at UHN. And we do that through utilizing Indigenous ways of knowing, being, and doing to advance a strengths-based approach to health and wellness, reconciliation, and partnerships. So the Indigenous Health Program at UHN has 6 priorities that we've identified that we are focusing on. First and foremost is the patient care piece. So providing that direct patient support to patients and their families. I'm not going to go into too much detail about that because Victoria is going to share more about her role as an Indigenous Patient Navigator a little bit later. Another priority we have is people. So really thinking about what type of support can we provide to staff across the organization, thinking about how can we recruit more Indigenous folks into healthcare careers, into UHN overall. We're thinking about how are we going to recruit more Indigenous folks into leadership positions? So making sure that we have that representation at those decision-making tables. And another priority we have is Indigenous placemaking. So really thinking about making those Indigenous focused spaces within the healthcare setting. It can be things such as physical visibility within the healthcare setting, thinking about artwork, thinking about wayfinding initiatives. But placemaking also goes beyond physical appearance. It goes into creating functional spaces as well. So at UHN, thinking about building those indoor spaces and indoor Indigenous health and wellness spaces where we can provide either patient support through consultation with the navigators, consultation with elders, knowledge holders, or and also thinking about outdoor spaces as well. So at UHN, we also have an outdoor garden space at Michener Gittigan. And it's a place where we can grow medicines, plants, different plants that have medicinal properties that we can use in health and wellness initiatives. It's a space where we do grow the four sacred medicines, and it's we're able to grow those medicines, harvest them as a team, and that's the medicine that we're able to provide for patient care throughout the year. These spaces also provide opportunity for educational initiatives, collaboration with various teams and programs throughout the organization, as well as community partners. So they're really, really great to have these spaces established within healthcare settings. Another initiative thinking about Indigenous placemaking is creating those spaces within libraries, within the healthcare setting as well. We've got a great partnership with the UHN Patient and Family Libraries team where they have been bringing in Indigenous resources and making those readily available as well. Education is another priority that we have. So really thinking about developing our staff force further, right? So thinking about cultural safety training opportunities for staff, doing in-service with different programs, just so we can share a little bit more about the program and the supports that are available, and encouraging staff to take it upon themselves as well to do a little bit of that learning themselves as well. Community relationships. So we do try to focus on getting out into the community on a regular basis as well, so that the community knows who we are. They see us being active members of the community that we're a part of as well. And just an opportunity to share resources and really making sure that we're really fostering those relationships that we have with the community. And the final priority is data quality. So thinking about data governance, appropriate data collection, interpretation of that data. So those are the 6 main priority areas with the Indigenous Health Program. Now, with the program, we also have these grounding principles. So these are principles that really guide us overall in everything that we do. So the 7 grandfather teachings are actually they're Anishinaabe teachings, but really, these are some shared values that we all have. So we need to ensure that we walk with these values every day. Not only in our personal lives, but also in our professional lives. So making sure that we do carry that love in our hearts when we're supporting patients, when we're supporting staff, making sure that we do have those respectful conversations. So just making sure that we're incorporating the 7 grandfather teachings in everything that we do through the program. And we also take a holistic approach to care. Victoria will share more about this approach to care, but in healthcare spaces, we're often focused on the physical, but through the Indigenous Health Program, we really try to take that holistic approach where we're looking at the mental, emotional, spiritual, and physical aspects to care. Victoria, maybe you can get into a little bit more details on the next slide there and speak a little bit more to that holistic approach to care.
Okay, so as mentioned before, we provide the medicine wheel model of care, so we focus on not just on the physical, but we focus on the mental, emotional, and spiritual, all 4 well-beings. In many Indigenous communities, we believe that to have everything balanced, we need to have all 4 of the quadrants to be balanced. If one is unbalanced, and then we're all unbalanced. So we just try to make sure for wellness support that we're connecting with all 4. It's not just about the 4 quadrants of, physical, mental, spiritual, and emotionally wellness. There's also many teachings in Indigenous communities of that whole different teachings of the 4 sacred medicines, the seasons, directions, elements, and 4 stages of life. Here at UHN, we do provide that support of having in the emergency department of these pins that has, asked me about Indigenous Patient Navigators. When we developed the program, when we first started, we wanted community members to feel safe coming into the merge. So we did come with having our program logo and then the medicine wheel there. So when a community member was coming in, they felt safe seeing that and then asking the staff, oh, what is this? And that's where staff could have those conversations. Hey, we have a Indigenous Navigator. Would you want to be connected to one? And just getting that consent from the community member if they would want to seek our services or if they don't want to seek our services. But just even having seen that visually, that's, brings that whole connections for community. So we do a little bit of education for each hire that comes in and just speak a little bit about the medicine wheel and how to refer us to as well. Some of the other programs have reached down where we did give out the pins to, so like the security team, spiritual care, the peer workers. So just having those, because they're the ones more direct, having that one-on-one supports with community members, and then hopefully who knows, maybe in other locations throughout the hospital, not just in the merge, but maybe other inpatient supports. So you might see that on staff's lanyards, just seeing that as well. So right now we're going to play a video that one of our patient navigators, Leonard Benoit, who's the inpatient navigator at UHN, that will share a video that he supported with a community member on their healthcare journey.
My journey with UHN began almost 3 years ago to the day when I was diagnosed with stage 2 invasive breast cancer.
Sarah Jane reached out to me because she wanted to do ceremony as a patient coming in having surgery. And it was really, really important to her to be able to have a space that she could do her ceremony, practice her culture, and ground herself as she was about to take on a really, really important new journey in her life.
An Indigenous Navigator is somebody who can oversee aspects of care that mainstream health cannot. There isn't one line of care, there isn't one line of spiritual care that you can look at. You know, being First Nations, Inuit, or Métis, there are many, many different communities. There are many different teachings, there are many different paths, and there are many different needs that could be fulfilled. Leonard met my son and I on the day of my first surgery to make sure that we had a safe space for ceremony. And he gave us all the time that we needed, but he provided that space, asked if I had the medicines that I needed, which I did, and then led us to where we needed to be. And the significance of that, of having that time to come together. Sorry, it's still emotional. It's exactly what my son and I needed, to move forward, that he could walk me as far as he could, that we came together and took the time. And, it's about centering and expressing gratitude. So Leonard's able to do that.
I've had a patient up on the surgical unit recently. First Nations man came from up north. English was not his first language, so of course, making sure that I could reach out to staff and say, listen, this gentleman speaks Ojibwe. And if he gets confused throughout the night, he's going to speak Ojibwe. Knowing that, okay, if this gentleman now needs a translator, we've got it in place. There's the language part of it. There's the preconceived notions of what First Nations people are when we come into hospitals. We are not thought of kindly. We're thought of as the deficit. We're thought of marginalized people. We're thought of drug seeking. We're thought of substance use, alcoholics, those kind of things. So those are the kind of things that when a patient comes in the hospital, how am I going to be treated? What is my experience going to be like now? So it's always making sure that when folks come in is having that education part, making sure that they've got my card, they've got my number, they know how to find me. And the other part is when I go up to the units, I make sure I identify as the Indigenous Patient Navigator. So he's in bed 2, right? Knowing that the hospital has made provisions for First Nations, Inuit, Métis people coming into this institution, that they can be cared for in a way that honors their path of well-being as Indigenous people. That to me is the start of reconciliation.
So in this video, you have seen one of our Indigenous Patient Navigators, Leonard Benoit, and also a community member sharing their stories while they were here on their healthcare journey, and just that impactful support as navigators could support with community members with that direct support. A community member was, scared coming into the healthcare department, and just having, just that support and having traditional medicines right before a surgery, or just having traditional medicines if there's conversation needed. And then also in the video, you do see that relation building within the Navigator and the UHN Health Team as well, and how they collaborate to support a community member on their journey. So at UHN, right now there's 2 Indigenous Patient Navigators. So myself, who works in the emergency department, and I'm covering both sites at Western and Toronto General. And then we also have our other inpatient navigator, Leonard Benoit, who supports all UHN sites. As mentioned before, so we provide a medicine wheel model of care to community members who self-identified as First Nation, Inuit, or Métis, and their family that are seeking care at UHN. Multiple roles that we shared is we attend appointments with community members and explain the healthcare journey and what to expect. So as mentioning, we could meet with them in the emergency department, or supporting more in the inpatient support. That's providing maybe just walking with them to go do their blood work, or follow up with appointments at clinics, to, maybe sitting with them during their testings. As navigators, we help connect with community members with the hospital and community support. So we're just not focusing on the physical, we're also supporting on the mental, spiritually, and emotional well-beings. So when a community member is coming into the merge, we're, you know, asking what else supports what they would need. You know, we're just not focusing on the physical. So for an example, if a community member is coming into the merge and, you know, they're coming more of for a healthcare, you know, maybe it's coming for something with pain, something that we'll provide is just, you know, connecting with them. Do you have a NP or in the community? Is there someone that we could connect to you as well outside? I could call Anishinaabe Health for you. Or another thing could be like, you know, housing too as well. If someone coming in and they're having issue with housing, sometimes we'll connect for like shelter spaces, or we'll provide them supports to connect with a housing worker, maybe at an Anishinaabe Health, maybe Native Child, any other community supports in the community. Spiritually, we do provide medicines here on site, so making sure if that's something that they will require on their healthcare journey, just to provide some of the traditional medicines with them, or also just sharing other Indigenous communities here in Toronto of like where they could access medicines too as well. And I'm also just sharing where our medicines come from for our medicine garden, and just making sure they're having those teachings and those knowledge where, you know, where our medicines are coming from and how we take care of it as a community. And then mentioning earlier, like we don't just have traditional medicines, we also have, you know, our drum, our rattles. We also have some connections in the community just to connect maybe with an elder or knowledge keeper if needed. And also we just don't hold some of those items. We, you know, carry other items where we provide some snacks. You know, we have books, coloring papers, crayons too as well, even some clothing too as well for community members while they're here on their journey. So to refer us Indigenous Patient Navigators here, we are connected through Epic. So any healthcare provider could send us a consult order, or even just message us in the Epic chat about a community member. Another thing is you could also give us a call. We're more direct to be answering our phones than, you know, instead of checking Epic, because we are, you know, all over the place within the hospital setting. As myself, I am in the emergency department, but I do support inpatient and also in clinic spaces. And I am moving site to site, so it's been really hard not to check Epic as often. So calling is more best suited. And then also sending us a direct email too as well. And also we also have an Indigenous Health email as well, where it gets checked daily as well. And then also community organizations do reach out to us, and also community too as well, because we do have little business cards and, you know, tear sheets that we do give out to community. So sometimes community will just call us that they're on their way.
Thanks, Victoria. So just to clarify, UHN does have two emergency departments, one at Toronto General Hospital, one at Toronto Western Hospital. We do have positions for an Indigenous Patient Navigator at each site. We're currently recruiting for one additional navigator, but Victoria is currently covering both sites. And as Victoria mentioned, you know, we can receive referrals directly through a patient referral. If patient wants to connect with our team directly, they can self-refer themselves. UHN staff can refer to our navigators. Community providers can refer to our team. We don't necessarily need a formal consult referral form. You can reach out to us via a telephone or via email if you want to connect with our team, and we'll assign a navigator, whether it's in the EDs or if it's within one of our other units at UHN. Now, Victoria, I'm just wanting to get a clear idea for listeners about what does a navigator role look like on your day-to-day. So thinking about your workflow on a day-to-day basis, what does a typical day, I know typical is not the best word because you do so many things and it's changing every day, But can you give us an example of what a day may look like for you when you walk into the doors at UHN to when you leave?
Yeah, I could speak briefly a little bit. So as an emergency department navigator, it's very hard to say because it's always different. But what my day-to-day is I could, come in and check in with with the staff and just, looking at emails, looking right away on Epic Order as well. So how I get my referrals is, if someone calls me, one of the staff too as well, or if like community self-directs messaging me. But I would probably say I could probably see 1 to 2 community members a day in the emergency department. And then that's also supporting inpatient too as well, here at Toronto General or Toronto Western, and just working with our Indigenous Patient Navigator of finding supports. Also, it's just connecting with other staff here at UHN. So doing some of that education piece of, talking about our program, sharing some education about some of the history, how to approach an Indigenous community member. Also just, putting some of the supports for new hires too in the emergency department and doing those monthly inpatient, like directly supports.
Thanks, Victoria. I just want to focus in on one piece that you had shared. So you mentioned that you're able to see 2 to 3 community members per day. And I just really want to focus in on quality versus quantity. As organizations, especially healthcare organizations, we are often focused on numbers, right? How many people can we see in one day? How many people can we fit into this clinic? Oftentimes appointments are limited to a quick 15-minute check-in, in and out. And sometimes that can be hard as a patient coming into care to not really have that time to really sit. So I think that's one of the amazing things about the Indigenous Patient Navigators is that they're not set on 15-minute appointments, half-hour appointment. They take the time that they need to spend with that patient, with their family, whatever the need is. They dedicate their time to provide that support. So really thinking about that quality of care that's being received, provided by the navigators, and taking that time to provide that support and care. So. It's something from an organizational perspective that I think is really great for folks to think about is, when we're thinking about doing that evaluation piece for these programs, not really focusing so much on those numbers, because that quality of care and the impact that has on that patient is so amazing. It's such a major thing. And then once our community members know that they have this extra care, where they have not extra care, when they have this quality care, they're going to share with their family, with with their friends, and they're just knowing that there's that support available is major. Thanks, Victoria. Now, you mentioned that you attend appointments with patients as well. Can you share a little bit more about what that might look like? So if you're, let's say, a community member has connected with you, they say, "Hi, Victoria, I've got this appointment in this clinic on Thursday. Would you be able to attend this appointment with me?" Can you maybe provide an example of what that can potentially look like? What type of support you would provide at that time?
Yeah, so there's 2 ways. Sometimes community members will just call me and say they have an appointment, this day and that day. I will tell them my priority is in the emergency department, but if I'm available, I will look at my calendar and, let them know if I'm available or not. A second one is usually right after emergency department, they may have a follow-up appointment, maybe with the internal medicine clinic, within a couple of days right after emergency department. So I'm ready there with them. So I'm sitting with them and we're having that conversations of if I could attend or not. So it's just mostly looking at my calendar of what my day is providing. I do ask them to follow up with me that day, probably like an hour or two right before their appointment, just to see if I'm available, because sometimes we do get emergency calls from, maybe from the emergency department or inpatient support. Things could change day to day. So I always like to have those conversations with community members, like, yes, I could attend with you, but please just follow up ahead of time so we could work with that. If I can't, that's when I would call, the Indigenous Patient Navigator and see their schedule and see if they're able to provide some supports moving forward. If not, for an example, I will reach out to like our health, our program, and see if there's anyone also available if needed. So it's just making sure we're working around with the community member schedule and just working around with our schedule and just seeing how we could provide that support. And then moving forward, like just how it kind of looks. So it's just meeting with them wherever they want to be meted. So maybe is it outside the UHN? Is it like in the food court? So that's some examples I provide to the community members. So I just wait with community members where they would want me to meet with them. I will walk with them up to the elevator and just sit with them in the appointment. I would also ask the community member giving consent, like, would you want me to sit with you inside the appointment? Sometimes I waited just in the waiting area, or I wait once they give that consent, I will sit with them during their appointments, and just providing that support of what they want. Do you want me to, sit right beside you, hold your hand? Do you want me to go grab you a glass of water? Do you want me just listen and then, just having those conversations after their appointment with the, with the healthcare provider, if they understood everything, and just having those conversations of their follow-up appointments and just working with them, the same thing again, like if I could sit with them for their next appointment too as well, and just walking with them, after the clinic, and just reassuring them, like, how did they feel? What else could I do to support next time? So just having those conversations with community members. Maybe, if it was too much, like offer like, hey, would you like to have a smudge? We could have that right now. Or do you want to go grab a coffee and we could just like, have a little walk and see how they're feeling after leaving here, leaving the space. And then that's another thing too, I find a lot is just making sure the healthcare provider is talking directly to the community member. Because sometimes when I come in, they'll be talking to me and I'm like, no, it's for the patient. I'm just here as a support. So just redirecting that, that way of just healthcare provider, this is the community member, this is seeking the care, I'm just here as a support, and just reintroducing myself to every care team coming into the clinics, my name and my role here at UHN.
Thanks, Victoria. So what I heard from that was that there is that continuity of care as well. So your role is primarily in the emergency department, but if they're referred to another unit, if you're available, you will try to support them in that space as well. Again, for that continuity of care and support. And if by chance you're not available to do so, we have another navigator that can support. So you'll connect with that navigator and they'll be able to continue providing that ongoing care. So that's really great to hear. I guess the overall, from what I heard, was that first thing is that you receive consent from the patient to make sure that they feel okay with you being present when attending appointments with them, and you provide, again, that medicine wheel model of care when it comes to the support as well. I heard you mention earlier something about having coloring books on hand, so providing that mental support by being occupied with coloring books or whatnot. There's the physical piece as well. You mentioned if there is any need for any sustenance through a snack or a coffee, anything like that. you had mentioned, the spiritual support that you're able to provide if they did need access to any medicines or a smudge, anything else like that. And then the emotional piece, right? Being, we all know just by having somebody sit with you and how important that is, right? To feel that emotional support. So just being present and there with them is really great to hear. And I know that you've also been able to provide support to patients through that advocacy piece as well. Sometimes, sometimes when we're in appointments with physicians, with our care team, sometimes we might be a little nervous to ask questions, or we might not quite know, how to ask these questions. So I know that they're able to speak with you, and if there's any additional advocacy they need, they'll let you know, and you'll be able to support them in that as well. Now, we've talked about the support you provide within UHN. What happens when they do need to, if they need ongoing care out in the community? I know it was mentioned earlier that you can help connect patients with hospital or community supports. So is that just meaning that you'll help connect to, community organizations, referrals? Can you speak to that piece a little bit more?
Yes, so when I connect with a community member here on their journey, I also ask who are their support people. Sometimes we have community members that just moved here to Toronto, or, who's been living here. So I always like to know who are their, support systems, and just connect with them, like, to start that point. It's just important just to see if, like, do you need support of me, to have a conversation with them if needed. Also just, providing my numbers if they want to reach out for any information. But I will also connect with community supports for, as I mentioned earlier, from, finding like a shelter space, maybe some programs, to looking for some healthcare providers here in the community. Also finding supports with, like, to access some foods, and then access to, like, any supports from, like, employment, maybe to some, like, information of education too as well. So anything a community member is needed, I do my best just to navigate that too as well. And then I will also connect, if needed more support, I will connect with the social workers too here at UHN and the emergency department, or even on different floors for things I'm not able to do. So even like maybe connecting to non-insured health benefits, or to making more referrals to home care community, referrals to like rehab. So things like that is an example where I would build those relationships with the social workers, introducing them to the community members, and all three of us, or even more people, just providing that care for community members. Also here in the emergency department, we do have the peer support, so just making those relationships too as well. Right now I am just one navigator, so sometimes I can't be at all sites, so just making sure I'm following up with, other healthcare teams and providers in the emergency department of, I'm not there at the moment, but this is someone I know and this is what they need. Can you provide that support? And if I'm available to come within that time, I will make my way over. So it's just making sure that we're also supporting the community members, but also building those relationships within the healthcare team too as well.
Yeah, that really does tie into one of those 6 identified priorities we mentioned earlier with regards to community relationships, right? And also those grounding principles. So really creating and creating those respectful relationships with community partners, so that we're able to work together when we're providing support, right? And that idea of reciprocity as well. So creating those relationships with the community partners, so that if you need to refer a patient to supports that are offered by that community organization, you're able to connect with them because you've established that relationship, and vice versa. If they have any clients that are coming to UHN, they know that they can reach out to you, so that continuity of care and support again when they come to UHN for care. So that's really great. last thing I want to touch on with regards to some of the supports that you provide. You mentioned providing those traditional or cultural supports as well. You've provided a lot of examples already with regards to being able to access smudging. You mentioned that UHN we've got our own bundle as well, so being able to provide a drum if needed, a rattle, anything that they may need. From an organization perspective, if there are any healthcare staff listening, how would you facilitate a request for a ceremony? Let's use an example of a smudging ceremony. How would you, as a staff member, facilitate that request when a patient comes to you asking for support with that?
Yeah, so I wanted to share it's not just the Indigenous Health Program to provide that support. It's everyone across UHN staff to learn that, because I'm not here 24/7. I'm only here Monday to Friday, 8 to 4. In the evenings, weekends, those are ongoing requested, needed by community members, wanting a smudge. So right now, UHN has a smudging policy, and it is being revamped right now at the moment. But right now, if someone was requesting a smudge and I was not available, those are some of the education pieces that, I would try to work with the staff ahead of time of, this is who you would have to contact. You would have to contact fire in facilities, just to turn off the fire alarms. And each room has like a room number on top. And that's the number that you would just give them, and just give them a date and a time of this is how long a person will need to use the smudge. And just letting staff know there is like signs too that has to put on the door. So who's ever doing the smudge, could have their ceremony, and not and want people coming in and out of the room as well. So it's just making sure those things are being done prior, and then once smudging ceremony is completed, just contact fire in facilities and they would turn back the fire alarms. And just like letting people around to know like what smudging's happening, if they do smell like the light of smudge, not to be alarmed. It's nothing harmful. It's just something ceremony is happening right now at the moment. And then also we do have a great relationship with spiritual care too as well, that have our medicines too as well if we're not available throughout the evenings and weekends. Spiritual care has our medicines, and we grew those relationships and provided those teachings where they sat with us making those bundles too as well for community members.
Thanks, Victoria. I would also like to add that, since our program has been a formal program since the fall of 2020, we have not set off any fire alarms. I know people are always concerned about setting off smoke detectors and all of this. We have not set off any fire alarms. And if you're not quite sure of what to expect from a staff perspective, maybe reach out and ask to learn a little bit more about what the ceremony may entail. We often sit with staff and have a smudging ceremony with them so that they understand what it actually looks like, what to expect. And once people do participate in a smudge, they often realize that, it's not a big a big bunch of smoke or anything. It's something that is very very doable within these healthcare settings. And I think I'd like to touch a little bit more on that and the next slide over. So, this third objective of finding how we can incorporate accessing these Indigenous health and wellness approaches to care, I guess. Victoria's already gone through the various different ways that she works to incorporate this into her into the work she does when providing that care to patients. But in addition to this, there's also certain rights that we should be aware of as well. At the next slide, please. So I really just wanted to highlight the creed and human rights for Indigenous peoples. So The Ontario Human Rights Code, I'll just refer to it as the code. The code does not define the word creed, but in general, creed just includes the belief systems that somebody may have that substantially influence a person's identity. So creed does include Indigenous spirituality. The code also does not define what Indigenous spirituality is, as we as Indigenous peoples have the right to define and determine what that is ourselves. So it's not up to the healthcare workers or organization to tell us what our practices are. It's up to us to determine what that is ourselves. Now, within the code, healthcare workers are considered service providers. And as a service provider, we as healthcare workers have what is called in the code duty to accommodate. So really, what that means is that under provincial jurisdiction, we as healthcare providers have a legal duty to accommodate Indigenous spiritual beliefs and practices. So, this can look like a variety of different things. For staff, this may include allowing time off for activities such as solstice celebrations or for attending ceremony. From patients, it may be making sure that we're offering space for them to access ceremony, such as smudging. So as healthcare workers, we have a duty to accommodate this. And if we are to deny these requests, so if we don't follow this duty to accommodate, we can be legally penalized through the Ontario Human Rights Code. So this is if you are if you're able to access the website Ontario Human Rights Code, I would recommend that you look up specifically Creed and Human Rights for Indigenous Peoples. They have these fantastic pamphlets that have more information, and I just highly recommend that folks have a chance to look into that a bit further. Can we move on to the next slide, please? So for this, the fourth objective here, when we're thinking about, the importance of having dedicated Indigenous health teams within healthcare organizations. So, why do we need to have these teams? First and foremost, there is ongoing racism and discrimination in healthcare. Unfortunately, we do see this on a regular basis. There are a lot of instances where there's been, a differential care provided based on how you identify. It's not just for Indigenous folks; it's across the board, right? So we know that racism and discrimination does exist in healthcare, and specifically, anti-Indigenous racism is quite prevalent within healthcare as well. So, in order to combat this, in order to create organizations that are safe spaces for Indigenous communities, we really should be having these Indigenous health teams that are embedded within the organization. Which takes me to the next point here, Indigenous self-determination as it pertains to health and wellness. The saying, nothing about us without us, right? You can't create Indigenous health programming or supports without Indigenous peoples. We need our own community members who are full participants in leading this work, right? And being leaders for this work. So full participation, thinking from program design, development, implementation, evaluation, interpretation of data. A lot of the times, data is misinterpreted. So, we need to have that full participation in all aspects, especially when developing this Indigenous health programming or supports. And we need that representation as well, right? I mentioned this earlier in the priorities section of the presentation, needing we need to have Indigenous voices present at those leadership tables, at those decision-making tables, because we have, unique approaches that are, from our own lived experiences, and those need to be integrated into overall, strategic planning for an organization or a program. And that organizational support piece, Justice Murray Sinclair had once said, education is what got us into this, education is what will get us out. So, if you're not quite sure where to start, education, start to educate yourself, right? Learn about the Indigenous communities where you live. Learn about the Indigenous communities where you work. Read up on, there's so many amazing reports that have been published. The Truth and Reconciliation Commission calls to action, Missing and Murdered Indigenous Women and Girls, the In Plain Sight report. There's so many amazing reports that are out there. Take it upon yourselves to do a little research, read up on it, right? Take some time to take some Indigenous cultural safety courses. There's many that are available online. There's many that are free. There are some that have some cost with it. Participate in any type of land-based courses that you may see available. Attend events that are hosted in your area, right, where you work or where you live. Just being present and attending these events, so you can start to learn a little bit more about the importance of those events and those ceremonies. And accountability, right? Once you have some of that education under your belt, make a commitment, whether it's from a program perspective, department perspective, at an organizational level, at a personal level, thinking about creating those truth and reconciliation action plans, right? So what are you going to do to work towards truth and reconciliation? And write it out. Write it out. What are the things you're going to do, and be held accountable to those actions. One big piece is also transparency. So, if you're taking steps in that right direction, be transparent about it. Publish your action plan, share it with the community so that they know what your plans are. Update it regularly, on an annual basis. Check back on the past year. This is what we committed to. Did we accomplish these commitments? Or where are we at on that trajectory? So, being accountable and transparent and sharing that with the community as well, and checking in on it regularly. Now, the last part here, what if the hospital that you work at, or if you're a patient seeking care, what if the hospital you're seeking care at does not have an Indigenous health program like how we have it at UHN? A few things that I would recommend. Victoria mentioned earlier working closely with other amazing programs that have been great allies and great supports to the IHP at UHN. Victoria mentioned spiritual care department. So, checking if your hospital has a spiritual care department. Nearly all hospitals do have spiritual care departments. So, check if they do have one, because they can provide supports. Do some research in the community, right? Where you may be located. Is there a local AHAC, so an Aboriginal Health Access Center? Like here in Toronto, one of the AHAC is the Anishinaabe Health Toronto. So, thinking about what is around the space where I'm seeking care, or the space where I'm working. What type of community organizations may I be able to reach out to for support for Indigenous patients that you may be supporting, or as an Indigenous community member, who can I go to ask for support as well? And really thinking about building those respectful relationships with those organizations as well, so that you can create those referral pathways to those community supports. I went over the Ontario Human Rights Code earlier, so knowing about those legislative pieces that can also support you. So as a patient seeking care, you know, knowing about Ontario Human Rights Code and Creed with Indigenous peoples, right? Knowing about what your rights are when you're seeking care so that you can ask for these supports. And if there is any type of pushback, any type of barriers to accessing those supports or the needs that you have, you're able to point out this legislation for that support. There's another one as well, Smoke-Free Ontario Act. Healthcare institutions are smoke-free spaces, but if you're accessing tobacco for Indigenous spiritual practices, such as if you're incorporating it in a smudge, that is something that is allowed. And again, if you happen to deny it, there is legislative penalties that can be either from an individual in the amount of up to 4,000 or from an organizational perspective up to 10,000. So there are these certain legislative pieces that do support your access to these supports as well. Victoria, do you have anything else that you would add to any advice that you would provide to either a patient or a healthcare staff member who may not have a program like IHP at their organization or at the healthcare center they're seeking? Would you have any advice for them?
Well, my only comment is every hospital in Canada should have an Indigenous health program, or just even having navigators. It shouldn't just be one person, it should be more of a team support. So that's my only thing, but you said everything, Ashley. I would just always recommend just looking at, hospitals are growing with more Indigenous health programs. I know they're designated to their own hospital, but just reaching out to them to see, like, do you have any knowledge where I could reach out to someone or so? We have a community member here. Can you help navigate? Or, like within multiple teams here in hospitals, like you mentioned, spiritual care, maybe reaching out to a social worker or just seeing if there's other representations of Indigenous community members in the healthcare and just asking those kind of questions, and then going into organizations within the city where you're at and just looking for what's available for support.
That was a great point, Victoria, with regards to needing more than one person, right? There's a lot of programs that get develop or positions, I guess, for a single person that's working, to support patient care, to provide strategic direction, and the amount of work that's required is substantial, right? We need more than one person. We need full teams that are hired. And as you mentioned as well, Victoria, we working together. So you mentioned how maybe connecting with the social work team, connecting with peers. We mentioned spiritual care department. Like, there are amazing allies that are within healthcare institutions as well, and creating those amazing work relationships with them as well. There's even the patient relations team as well. If you're a patient that has experienced unfortunate, we mentioned ongoing racism and discrimination. And if you are a patient that has experienced that, every hospital has a patient relations team as well that can help support you through addressing those concerns. So thanks, Victoria, for that. So I guess with that said, where, for all those listening, where can folks go to for more information?
So where to get more information, please refer us at the Indigenous Health Program. Myself as the Indigenous Patient Navigator in the Merge, or supporting Inpatient 2. We also have Leonard Benwell, who's our Inpatient Navigator 2 as well. Connect us through Epic. As I mentioned, we have the active order. You can send us the Epic chat, even just more betterly, please call us because we're more access to our cell phones. And then just email us if you have any questions or, any support, please reach out.
that general inquiries email, it is
Yes.
monitored by by various members of our team as well. So if you are referring a patient, if you're a patient yourself and you're not quite sure if you want to be directly referred for Navigator to be at an appointment with you, or you're just not quite sure, the general inquiries email is meant for any questions you might have with regards to the program or supports available. So even if you're not sure you want to be referred yet, reach out. If you're a staff member not quite looking for resources, reach out. If you're from another organization that's looking to hopefully encourage starting up a program at your organization, reach out, where we are open to sharing. That's such an important thing, is being able to share what we each learn right throughout this process. So that email is open for anything, any questions that anybody may have.
And here at UHN and the patient and family libraries, as mentioned, there is resources, for Indigenous community members and for patients and for, UHN staff too. So always take a look at over there. But there are trained health information too and specialists that can help up-to-date information. The phone number is right there as well with the email, and they are open Monday to Friday from 9 to 4 p.m.
So on behalf of the patient education team here at UHN, I wanted to take a moment to thank Ashley and Victoria for speaking today about this really important topic, providing practical tips that healthcare staff and patients can use that are available for Indigenous patients and families here at UHN and also in the community. So thank you for sharing your expertise and knowledge with us today. Before we close off, your feedback is important to us. So for those who are watching, please go to the link on your screen and complete the survey at the end of this video. The link will also be available in the description box below. Your feedback really helps us to know what you liked, what we can improve on, and what topics you would like to see in the future. And to keep up to date with our health talks, you can subscribe to our online patient e-newsletter to get up-to-date information about events and new resources at UHN. To fill out a form to subscribe, you can go to the link on your screen, and we'll also have this linked below. Thank you again for viewing this talk. We hope to see you at our next session in May on the topic of preventing and managing pressure injuries. Thank you, and see you next time.